The word Snoezelen comes from two Dutch verbs, snuffelen, to sniff and explore, and doezelen, to relax. Snoezelen therapy, or multisensory environments, has its origin in the Netherlands, where it was first introduced with children with autism. More recently, Snoezelen therapy has been brought here to the United States to be used as a new therapeutic modality with residents with dementia. Let me introduce you to our multisensory environment. Residents with dementia often have agitated, restless behavior. We find them picking at their skin and sometimes making lesions on the skin, picking at furniture, picking at clothing. As a way of diverting that energy, we'll bring them into the Snoezelen room and allow them to interact with the fiber optic spray. The spray changes colors automatically, which allows the resident to interact both visually as well as with the sense of touch. Symptoms of lethargy, poor energy, no motivation are often symptoms associated with dementia. In an effort to bring our residents out of their rooms to interact in their environment, we bring them into the Snoezelen room to stimulate those senses by use of environmental sounds. We use our birds, photos of water, of nature sounds and nature images to intrigue the senses and cognitively stimulate the residents. Short-term memory is lost with dementia, but oftentimes long-term memory remains intact. Therefore, one of the things that we use the Snoezelen room for is to try to stimulate or cue that long-term memory, perhaps by use of a familiar object, such as a bird, where residents might be able to relate and tell a story from their past related to bird feeders or bird watching. The bubble tube is probably one of the most popular items here in the Snoezelen room for a variety of reasons. Many of the residents enjoy interacting with the bubble tube because it's a cause and effect. They can actually create change in their environment by pressing the colors on the wheel and making the tube colors change. In addition, many residents will sit next to the bubble tube for a long period of time, experiencing visually the changing colors, but also having a sense of tactile stimulation by touching the tube and experiencing the vibrations. Research has begun to examine the role of projected images, how the brain interprets those images, and what effect that has on our emotional system. Not surprisingly, these results reveal that images of a more calm, serene nature tend to lower the heart rate and lower the blood pressure, as opposed to images that are more cognitively complex, such as animals in a forest, where the mind has to pay attention to details. These images tend to be more stimulating and create more alertness in residents who may already require some stimulation. As dementia progresses, often residents lose the ability to communicate through language, leaving them only with their senses as a way of interacting and communicating their needs. Here in the Snoezelen room, we use a variety of textures to stimulate the sense of touch. Knowing that the sense of touch is very important to calm and soothe fears that can often arise with residents, our staff will bring residents here to the Snoezelen room and provide them with gentle hand massages, neck massages, shoulder massages, by utilizing the hands and also soft items to provide them with a sense of relaxation. Aromatherapy has begun to gain much popularity in the use of healing environments and integrative medicine services. Here in the Snoezelen room, we use aromatherapy to infuse different smells to the room, such as lavender or vanilla, to create a calm sense for those residents who come in feeling restless or fearful. For those residents that we are trying to stimulate, we will infuse smells such as tangerine or orange, which research has demonstrated tends to stimulate the mind. Music therapy is an integral part of the services that we provide here in the Snoezelen room. Music, as the universal language, is a way for us to connect and relate to our residents who've lost the ability to communicate through comprehension and reasoning. Music therapists will bring residents here to the room to calm, soothe, or stimulate. As you can see, our Snoezelen room is truly just a multi-sensory experience. You don't have to understand, comprehend, or reason your way through the environment. You simply have to come and experience. It is because of this that our residents find this room soothing, relaxing, and stimulating. They are not frightened, challenged, or intimidated in any way. As a result, many of our family members are utilizing the Snoezelen room for their visits. They don't have to find conversation, repeat themselves, or feel frustrated that they don't know what to interact or what to say to their family member. This room, both the family member and the loved one can simply experience one another and the room. We're finding that the enjoyment of being in this room has really added to those visits.